Hello everyone, my name is Brooke Schwartz and I'm a third-year medical student at FIU Herbert Wertheim College of Medicine. Today I'll be speaking about my team's work on the assessment of firearm violence prevention integration in medical school curricula. I'd like to take a moment to thank my co-authors, including fellow students Praveen and Cesar, and faculty, Dr. Schneider, Dr. Clarke, and Prasad. Firearm-related injuries are the number one preventable cause of accidental injury and violence-related deaths in the U.S. annually. While both public health practitioners and medical educators recognize firearm violence as a public health crisis, most medical schools in the U.S. lack education on firearm safety in their curricula. What's even more concerning is that most medical students feel uncomfortable with and are likely to avoid the topic altogether with patients. My team and I are trying to combat this public health issue by encouraging the integration of firearm violence prevention into medical school curricula. We have published a Firearm Violence Prevention Curriculum Guide, or FVP Guide, on how we have done so at our own medical school, FIUHW.com. This guide can be found on the AMSA website under Medical Students for Gun Safety. Figure 1 displays the cover of this guide. The curriculum guide's focus is on how to speak with patients regarding firearm safety. We would like to emphasize that the goal of this guide and our curriculum is on firearm safety, not firearm control, and does not wish to fall under the realm of politics. Based off of the FVP curriculum guide, our team created a single-session training in the form of a PowerPoint for second-year medical students at FIUHW.com. Students were given a pre- and post-session self-assessment questionnaire. The response to each question was then categorized and computed into average values that were then compared using a Mann-Whitney U-test. An example of the pre-session questionnaire is below, Figure 2. The post-session questionnaire had the same questions and additionally asked how satisfied they were with the session. Table 1 displays the results of the Mann-Whitney U-test for each question of the survey. You can see that students' attitudes about gun violence being a public health issue did not change significantly. However, student comfort in asking about gun ownership increased significantly. Student comfort with counseling patients on gun safety increased significantly. Students' perceived role in firearm violence prevention increased significantly. And student comfort in teaching peers about firearm violence prevention increased significantly. One limitation of the study was that we were unable to use participant identifiers, which meant we have been unable to track individual attitude changes. We were only able to report group changes. In the future, we would like to ask an additional question to gauge how likely our learners are to bring up the topic of gun safety to a future patient. In conclusion, this study suggests a single training session increase medical students' confidence in querying patients on gun ownership, comfort in counseling patients and teaching peers about gun safety, and sense of their roles in firearm violence prevention. Our team hopes that other medical students and medical educators will not only become more aware of the Firearm Violence Prevention Curriculum Guide, but also understand its efficacy. We hope they will improve it and use it to incorporate firearm violence prevention into their own medical school's curriculum. Thank you so much for listening and for this opportunity.